Hi, it's Dr. Deering. I want to share with you a little bit about our new technology and why it's important to measure your balance. We have fun little fancy apps that we can use on our phone to measure balance. We use them in concussion risk assessments and pre-season baseline testing. I encourage everyone to have the app that we use. We're going to put information into our posts about this app and how you can access it and how you can measure your own balance or your children's balance pre-season. But I'm just going to show you what we're measuring with balance and what maybe that app is measuring as well. In the office, we use force plate posturography. We've used it for a long time, but here on our newest measurement device, we have a treadmill that also has that force plate posturography for either walking or running or just standing still in a static balance. So we want to measure Katie's balance in this situation. We want to put her in different scenarios, whether we have feet together and we're closing the eyes. Sometimes we're rotating the head into different positions to see how much involvement there is of the neck or the vestibular system, the inner ear. As well as we put her in other challenging positions like one foot in front of the other and see how well we can hold a tandem stance. These are classic measurements of certain aspects of balance in neurology, and the things that we can gather from it help us to target and treat particular areas of the nervous system or the spine or a combination of the two to help individuals' brains function better and more efficient. And we can apply therapies and we can measure pre and post treatment, and we can see the improvements. In almost every case when we're working these systems, it's tremendous to increase your balance. Balance is one of the most important life-saving things that we see as the years go by. As we get older, we want to maintain balance, and we do that in the office every single day, whether it's brain injury and loss of balance, or whether it's aging or strain or stress or pain. We want to measure those things. So I'm going to have Katie take her feet and put them together, nearly together and touching. And so we're just going to get a standard Romberg's test, and it's a balance test that has been used for a long time. And so here, with the feet together, you're just going to stand in a good neutral posture, and you're going to close your eyes. And when she closes her eyes, we would be recording. We can measure the distribution of the weight shifting. Right? With her feet together here, she's pretty balanced. There's not a whole ton of movement. She's also wearing shoes. Normally we would have just the feet, and we would watch the feet and measure exactly how the person moves. And then we would go into another test, and we might say, stand on your left leg and just try to hold yourself on that left leg, and when you are comfortable, close your eyes. A lot of people are very uncomfortable with this. This is not unusual. You can open your eyes. And it is a very sensitive test. It's a sensitive indicator. We can see which direction she sways or which direction she has the most imbalance. And we will compare that to the other side. And so you'll stand on your right leg and close your eyes when you're comfortable. And so we see this. You can open your eyes and relax. Over the period of time that we're measuring, we watch that elliptical pattern of sway. We put the patient in different measurement areas. Now I want you to take your left foot and put it right in front of your right foot. And heels touching the toe on the opposite foot. So this is a tandem stance. This is quite difficult as well. So here we're going to have you look straight ahead and close your eyes. And we measure the swaying pattern. This is exactly what the app does. You can open your eyes. In our app, we hold a phone to the chest, and you can measure your balance, and you can measure other functions of cognition. In addition to balance, they are very much correlated. So when we apply therapies, we are remeasuring tests just like these to be able to pinpoint improvements and find out what needs to be improved a little bit more. So this information is changing our practice. It's changing the way that medicine and rehabilitation is performed. And we are very excited to have the technology and to be able to see it and to be able to deliver that information to patients and show improvements along the way. So like this information on our page. We're going to put out little bits and research here and there as we put out more posts and show you exactly what we're doing and all of the wonderful results that we get from using this type of treatment. So like us on Facebook, hit the like button here on this page, and follow us on all of our social media, and you'll get all the information that I can possibly provide. All right, have a great day.